Sir, shall we start, sir?
Yeah, please.
So you can start, sir.
Good evening. Welcome to Auricle 90-day Prof Preventive Mastery classes of Preventive Medicine, Obstetrics, Pediatrics, and Geriatrics, session 3. Okay. Today we'll be learning about the obstetrics, pediatrics, and geriatrics topics. The remaining part is the geriatrics as of now, and there are some questions about pediatrics also. Auricles give you rapid revisions of all the important questions, volatile facts, and quick revision of all the most important questions and all the expected topics for coverage. Today we'll be discussing about geriatrics in one of the main questions, that is various health programs, health problems, which is including physical, that is organic, psychiatric, and social problems of the elderly, and what are the remedial measures of that, and how can their health or welfare can be promoted. And in short answers, breastfeeding importance and their why it is done, and anthropometric measurements in children, describing of the growth chart which we are using in India, and school health program. These are the 5 questions we'll be covering today. Why choose Auricle? Auricle provides you 5 modes of learning, that is recorded classes, live classes, practical sessions, exam modules, and hard copy book sets. In recorded classes, you will be having flexible learning and convenient revision of all the most commonly asked topics, so that you can listen to them if you are not able to see to the screen, or you can just do it like a webinar or a recorded class as well. In live classes, you will be having one-to-one classes with comprehensive coverage, which includes 10 years most important anticipated questions, and you'll be learning from the highly qualified educators. Okay, they'll be teaching you about the answer writing skills, concepts, and study plans also. Next, we have express exam module, which includes that you'll be covering your whole topic in 20 hours, the whole subject in 20 hours, so that you can have fast revision before you go to the exams. Okay, and you'll be, as such, you will be getting the flowcharts and exam writing based on strategies also. Okay, and we have one-to-one doubt clearing sessions. It will be very friendly for students, and all the students will be given utmost importance for their utmost smallest question, whichever is asked, and it will be cleared for everyone, and it will be student friendly, and it will be a safe learning environment of all the students. Hard copy book sets will also be provided with all these things, so that you can revise all the topics in a comprehensive way, and you can read it like a novel, and you can clear your doubts during the one-to-one sessions. Apart from this, you will be getting question bank also, which has 3 levels of expertise from beginner to expert level. This is very important for you in prof exams, NEET PG, and FMGE exams. Okay. In practical sessions, you will be given a very simple way of teaching, and you will be able to grasp the concept so well that you can go and attend your Viva OC exams and practicals exams with full confidence. To get all these, we have around 4 subscription plans. Foundation plan for 3 months, which is for 19,999. Advanced learning plan for 6 months, that is for 32,999. And complete learning plan for 59,999. And ultimate MBBS plan for 4 years, which is for 1.9 lakhs. And it not just these, you will be getting with a very good subscription discount on the codes which is displayed below. So please do subscribe Auricle and plan your exams in advance. Okay. Coming to the case scenario for today's session. Mr. Ramesh is a 72-year-old retired school teacher living in a small town. He lives alone since his wife passed away 5 years ago. His 2 children live in different cities and visit occasionally. Mr. Ramesh has a history of hypertension and diabetes, which he manages with medication. Recently, he is experiencing memory lapses and difficulty in performing daily activities. Why this is important? Because most of the population which is there in India is of 25 to 45 years age group. In another 30 years age group, you will have a burden of, we don't say burden, you will have the population of old age, that is 45 plus. Since the families are planning for one child or maximum of two child, the population of young age reduces. However, the population of 45 plus increases in the next 20-25 years. Hence, the geriatric population will be the more clientele for doctors than the young age group. So addressing their problems also becomes a priority in coming years. The first long answer, today we have only one long answer for today. That is, describe the various health problems of the aged, such as the remedial measures, and how can their health and welfare be promoted. We'll look at the three questions the first question and the second question together, and general health and welfare measures will be later. Coming to the problems, it can be of three types: organic, psychological, and social. Organic means there is a problem which exists, which you can measure or which you can see. Psychological, which you can't feel but the patient can feel and express. Social, which are related to the loneliness, abuse, availability of facilities, all these things. Okay. Organic illness, we have, that is problems due to aging and problems related with long-term illness. These as such appear because of the age, and this appears because of the presence of the present disorder or the disease. Okay, we'll see one by one. Senile cataract, what they do is they impair the vision to a very great extent. And what does it affect in their daily life? They affect reading, driving, and recognizing faces. Okay. Again, untreated cataracts, they can cause significant disability. How? They increase the risk of injuries and falls. What is the remedy for this? One is surgery, cataract extraction with IOL, intraocular lens, that is the definitive treatment. Post-operative care, which includes the prevention of infection and management of inflammation. Preventive wear measures are regular eye examinations for elderly, AV protective wear soon after the surgery, and managing conditions like diabetes that increase the risk of cataract. Okay, this is one of the common problems. Next, we have glaucoma. Glaucoma, it affects vision, but it affects loss of vision, but very slowly, and it may go unnoticed and unnoticed until the person loses his vision completely. When the vision becomes significantly reduced, then people might give a thought of examining for glaucoma. Okay, this can lead to partial or total blindness depending on the pressure of the eye and the damage. What are the remedies? Are medications or surgery to prevent the optic nerve damage. Otherwise, preventive measures are regular eye screening for glaucoma, and for high-risk individuals with family history of glaucoma or diabetes or hypertension. All these, the patient should be monitored for it. Otherwise, at least once in 6 months, the vision should be checked for glaucoma as well as cataract. These are the vision problems. Next, we have nerve deafness. As the age goes on, the sensitivity to hear, listen will go down. Sorry, there is a mistake here. This was not supposed to come here. Okay. This was not supposed to come here. Okay. And what is the remedy for this? Using hearing aids, cochlear implants. We have a very good cochlear implants. Even we have external implants and internal implants as of now. And auditory in rehabilitation to improve the communication. Reduced communication again causes loneliness. Okay. Preventive measures, avoiding prolonged exposure to loud noises, managing risk factors like cardiovascular and diabetes. Osteoporosis, which affects the mobility, like fractures, especially if fractures can result even in minor falls. Fracture neck of femur is most common in females, which causes decrease in mobility, prolonged bed rest, increased risk of complications like pneumonia and DVT. Apart from this, it increases the social factor called dependency. This is one of the major effect which causes dependency on the younger age group, is which causes a social problem for them. Medication, biphosphonates, calcium, vitamin D supplements, weight bearing exercises, physical therapy to improve strength and balance. Preventive measures, adequate intake of calcium and vitamin D3, regular physical activity, which we do not do in India. It is more important to keep all the joints mobile by doing regular physical activity after 40 plus. If something has to happen to stay normal at the age of 60, the investment should be at 40. Okay, that investment is physical activity to stay fit at 60. Okay, apart from regular physical activity, resistance and weight bearing exercises and bone density screening for early detection if there is a problem of osteoporosis. Okay, most commonly in females, osteoporosis starts after menopause, so that has to be treated with calcium and vitamin D3 supplements. Emphysema, which causes breathlessness, fatigue, and reduced ability to perform physical fitness. Agreed. It can reduce the quality of life and lead frequent hospitalizations and increased risk of infections. Why does this happen? Smoking, pollution, and infections. Previous infections also do cause if there is any fibrosis. What is the remedy? Smoking should be stopped completely. Use of bronchodilators, inhaled corticosteroids, that is, all the medication should be taken on time. Preventive measures, avoid smoking and exposure to air pollutants, early treatment of respiratory infections, and vaccinations, influenza and pneumococcal vaccine. If any UG student wants to do a study, this is one of the topic where you can do. That is vaccination for geriatric population. You can take up a ICMR case, student case study, and you can do this topic because vaccination for elderly is still a discussion topic in India. Okay. Failure of special senses. Special senses include taste, smell, already vision and hearing is done. Okay. All these things, what do? Is they decrease the quality of life. Okay. And they can't enjoy the food. So they tend to avoid food, which leads to malnutrition. Again, it leads to accidents. They can't enjoy food, so they don't go out to any functions. This causes social isolation, all these things. Okay. Remedy, corrective, uh, for vision, it is surgery. For hearing, it is hearing aids, and rehabilitation strategies for sensory decline. Again, preventive measures, regular screening of all special senses, managing risk factors, that is diabetes and hypertension. Diabetes usually causes decrease in sensitivity. Okay. Organic problems due to aging process, that includes the mental outlook also, like how I look at the life or how I look at the others. Okay, that is a part of mental outlook. It can lead to social withdrawal, loss of interest in life, and diminished ability to cope up with stress or illness. Okay, this can not only change the outcome of the patient, it worsens the outcome, gets worsens because of the mental outlook, which can worsen the physical health outcomes and mental health issues also. What are the remedies? Psychotherapy, medications, ask for help. and social engagement programs and counseling services. Preventive measures, social support, maintaining social connections, physical activity, engaging in mentally stimulating activities, and early intervention for mood changes like mood stabilizers and mood elevators. Like fluoxetine can also be given, that is SSRI. Degenerative disease of heart and blood vessels. This can lead to, this is all these things which I've learned till now is because of the uh, problems because of the increasing age. Now we'll be talking about associated with long-term illness. That is there is a illness and what happens because of that. Like if there is any hypertension or diabetes, these are all existing illness and what are the later problems with that. We have degenerative disease of heart and blood vessels, which can cause angina, stroke. Patient again, the elderly became less active, dependency, which is because of that. And what is the way out for this? Regular medication, improving the compliance, and lifestyle modification. What is the lifestyle modification we suggest? Healthy diet and exercise, surgical interventions on time, not to be postponed or neglected. And preventive measures include controlling of risk factors. Those are existing risk factors and modifiable ones. Hypertension, diabetes, cholesterol, alcohol, all these things to be managed accordingly for prevention of degenerative diseases. Cancer, you can't predict it when does it occur for you. So the risk of various cancers is always there with the age. So regular screening of the individuals for mammography, CA cervix, avoidance of smoking, all these are preventive factors. Okay. Remedy is treatment on time, on after regular screening, not to postpone or to neglect. Postponement and negligency are the most important factors which affect the outcome of the patients in the elderly. Okay. Accidents like falls, which is common in very in old age group, which can lead to serious injuries, head trauma, which may require surgery and extended recovery periods. The recovery rate is going to be less in the elderly, so avoiding of accident is more important than treating the accident. Okay. What is the accident more common? This is the contra trend. I will fall, so I will not walk. Again, I will be dependent on the individual who is younger to me. Okay. Remedy, treatment of injuries. Preventive measures are taking a walk stick, bars, non-slippery floor in bathrooms. There are n number of facilities available to change the flooring of the bathroom so that people don't get slip while bathing. Okay. And availability of hand bars while going to washrooms, hand bars while taking bath. All these things are to be modified in the living localities. Okay. Diabetes, again, it causes complications of neuropathy, retinopathy, kidney damage, and cardiovascular disease. You have to remember three pathies: neuropathy, retinopathy, and nephropathy. These are the complications of diabetes. This question can be asked in your Viva of medicine. Mention three microvascular complications of diabetes. Those are neuropathy, nephropathy, and retinopathy. Okay. Managing diabetes is elderly is often complicated by their health issues. Okay. Again, medications, good compliance, good outcome. Medications on regular diet modifications and preventive measures include good diet, regular physical activity, weight management, regular screening. If this thing is done, diabetes can be taken care of. Coming to the next problems, that is locomotor system. Arthritis, particularly osteoarthritis, is a common degenerative disorder in elderly, which is causing pain and stiffness, and other musculoskeletal disorders, pain, stiffness, inability to get up in the morning, all these things. What is the remedy for this? At the old age, it is only pain management. At advanced therapies, it is joint replacement surgery and rehabilitation to restore the function. But how will you prevent? Again, starting off physical activity at early age gives the longer life of your bones. Regular physical activity, maintaining a healthy weight. Healthy weight doesn't mean that I am fit and fine, I will do the bodybuilding, I'll increase my body weight. No. Appropriate body weight for a person who is of 170 centimeters is 70 kgs approximately. Okay. This is according to the one of the formula which you will go back and read, which was taken around 2 weeks ago. Okay. Early treatment of joint and musculoskeletal pain to prevent long-term disability. Good food and regular physical activity and maintenance of healthy weight will solve this disease of locomotor system in a very easy way. Coming to the respiratory illness, infections like pneumonia, bronchitis, all these are common in the old age. How does they increase or the risk factor of the infection increases? Because of the pre-existing conditions. If the individual had asthma, again it gets complicated. If the individual has emphysema or fibrosis of lung or tuberculosis in the past, which can get reactivated because of the reducing immunity. Okay, but it will be very life threatening for the elderly, so it might lead to a compromising of the lung function. Remedy, again, antibiotics, oxygen, bronchodilators, and corticosteroids. Preventive measures, smoking, vaccination should be stopped, vaccination should be taken, that is for influenza and pneumococcal. Avoiding respiratory infections, that is polluted areas, and regular screening for respiratory symptoms. And next we have one of the important thing, and which is having a very good psychological impact on the human beings, that is genitourinary system. Common problems in the females of elderly is urinary incontinence and BPH in males and UTIs in females. Why did I say urinary incontinence for females? The urethra is short, okay, and there's laxity of pelvic muscles as the age goes on. If there are multiple pregnancy in the younger age group, again the laxity of the pelvic muscles are weak, increases, and again there's urinary incontinence. Urinary incontinence causes mental harassment to the elderly and it causes social isolation. They does not mingle with people, they does not speak to anyone, they don't go out of the house. In fact, they don't come out of their rooms. Okay. In males, BPH increases. The screening should be started at least 45 years of age for BPH. Okay. UTS causes confusion, delirium in elderly. Again, it causes retention, discomfort, and need for surgery. Remedy, medications, pelvic floor exercises. If any BPH is there, again, prostatectomy and lifestyle modifications like bladder training. And one more remedy for this is adult diaper also can be used. Preventive measures, pelvic floor strengthening exercises, maintaining the healthy weight, fluid intake, and timely treatment of infections will reduce the complications of further infections and complications also. Now we have psychological problems of the elderly, like impaired memory, rigidity of outlook, and dislike of change. My grandfather never liked the change, even though he was alive, even after the arrival of mobile phones, he resisted to adopt the change of communication of mobile phone. That is one of the resistance you can come across. Again, reduced income leads to foreign living standards of the elderly. Again, it will cause depression. Social consequences will be there, isolation, all these things. If someone is working in a job where there is no pension, again, there is no income after the retirement, it will cause social isolation. Remedy, cognitive stimulation and routine organization, that is establishing a routine, daily routine, such as reminders, lists with the speaking with memory, like speaking with people for memory or speaking every one relative a week, which improves the memory. Medical intervention for uh, dementia or Alzheimer's disease can be done, and cholinesterase inhibitors can slow the progression, but however, it cannot stop the progression. Preventive measures, regular mental stimulation, like speaking to one relative every alternate day or once in 3 days or a week. This increases the memory function. Okay, physical exercises, group discussions, group activities, going out to a what you say, outing in groups, elderly after 60. People who are physically fit in 60 to 70 years age group, they can go out for a what you say trips, elderly group, so that it increases their communication and social mingling also. Sexual adjustment, between 40 to 50, there is a cessation of reproductive of by women and diminution of sexual activity part of men. During this phase, physical, emotional disturbance may occur. There will be irritability, jealousy, all these things. Remedial measures, open communication, ready to discuss, which does not happen in India, but it has to be encouraged between the partners and all the feelings to be expressed. Misunderstandings leads to frustration. Okay, and sexual health counseling, again opening up of for a patient. For this map, it is a Herculean task. But it helps in reducing of anxiety and improves self-esteem and foster intimacy. Medical interventions, medications like tadalafil can help in males. Testosterone replacement therapy can be considered if low levels of sexual affecting sexual function. Hormone replacement therapy in females can be useful for relieving the symptoms of menopause and mood swings and vaginal dryness. Lubricants can be suggested of addressing the physical health, that is diabetes, hypertension, all these things can increase the sexual well-being. Other things are like redefining the intimacy. It is not only the intercourse, it is like hugging, kissing, and touching also can be done for maintaining the intimacy. It is not just the sexual intercourse. But the major drawback, major challenge in this is elderly opening up to a doctor for all these things. Okay. Psychological problems. Sorry for the large text because it was needed. Okay. Result from social maladjustment, degree of adaptation to the fact of age is crucial for many phases of life. Failure to adapt of my old age is one of the major psychological factor. I don't want to get aged is a major problem in some of the people. How can this can be done? By psychotherapy and counseling and medication like antidepressants, anti-anxiety drugs, alprazolam, etazolam can be prescribed. Antidepressants like fluoxetine 20 mg can go up to 60 mg or 80 mg maximum can be prescribed, but psychiatrist advice should be taken care of. Psychiatrist should be advising all these drugs, not just the medical officer. Social support and engagement. Again, emotional disorders in the elderly will be major. Mingling in their family groups can help this. Family and community involvement, strong family support, and regular social visits from friends. Physical activity, yoga, walking, all these things will improve. Mindfulness and stress reduction by doing meditation, breathing exercises, and following their daily routine and having a hobby like gardening, having a pet, all these things will reduce the emotional disorders in elderly. Okay. Coming to the social problems, isolation and loneliness. After retirement, the work colleagues are there, even they get retire, so they might get relocated and they may feel alone. And death of the loved ones or the partner causes social isolation and loneliness. What is the remedial measures? Community engagement, how? By creating senior groups, clubs, and religious organizations, and planning for trips of in religious places for the elderly. This can reduce the social isolation and loneliness. Technology integration to make video calls of their age groups, social media groups of elderly, and maintaining connections with their friends helps to reduce the social isolation and loneliness. Pet therapy, having the pet, do help in reducing the loneliness and improving this emotional well-being. Financial strain. Plan your financials at the age of 20 to 40 to be better off at 60. It includes now the medical students who are watching this video also. Plan your finances. Otherwise, financial strain will be the biggest strain and stress in the retirement age group. Many elderly lived on fixed incomes, okay, which does not cover for everything. So, emergency fund, backup fund, all the funds should be created. Okay, remedial measures, financial counseling, government assistance. We'll see later what are the government assistance provided, subsidy services, and employment opportunities for elderly. Okay. Next, we have elderly social problems like abuse. What kind of abuses can be there? Physical, emotional, or financial? Just a minute, I'll have to start a poll also. I'll be launching the first poll now for 10 minutes. Okay, later we'll see. And remedial measures include education awareness, reporting system, caregiver, and monitoring systems. Dependency of caregivers, physical and cognitive decline can lead to loss of independence, creating reliance on the family and or paid caregivers. And all these things are remedial measures which you can read, but I think this is more than enough if you write all these things for a 10 marker. Housing problems, lack of appropriate housing or maintaining their house. How? Providing the affordable housing options by providing government subsidy, senior apartments, and housing cooperatives. Modifications of home, like installing the ramps for the wheelchairs, providing the grab bars inside the lifts and down the stairs who can climb, and grab bars inside the washrooms and inside the malls. All these assist in decreasing the social problems. Assisted living facilities, like there can be a appointed nurse who can take care of the medical conditions or who can give the physiotherapy care, and sharing living arrangements, like uh, it is still in India, your parents live with you, which reduces the feeling of isolation. How does it, why does it break? I'll tell you. If the children are not taken care of now, you will not be taken care of when you are elders. It is as simple as that. Access to healthcare. In a country like India, there is always a difficulty in healthcare, particularly in rural areas and underserved areas. How can this can be tackled? By telemedicine services. WhatsApp is a very good mode of telemedicine. Affordable healthcare, that is by providing free of healthcare by providing medications, chronic disease management, and preventive services. Ayushman Bharat Mission, ABHM. This is also one of the uh, services where the health is covered up to 5 lakhs. Mobile health clinics for villages, transportation to healthcare, that is free transportation for elderly to healthcare facilities. When cataract surgeries are launched under the National Eradication of Blindness Program, even the transportation is provided free of cost from the campsite to the surgery and back to home, so that the individual is not getting affected by the treatment, or they don't have to invest or spend on the treatment. Out of pocket expenditure is less. Okay. Home healthcare services, there are certain apps which are available in the metro cities where the medical team visits for examining the patients and providing the treatment. This is one of the possibilities. Okay. Bereavement, that is death of spouse, family, friends, family members, etc. By providing counseling, support groups, spiritual support, and social integration. With whom? With the community and the family members. And the other social problems are transportation difficulties, inability to drive, leading difficulties in accessing the social services and healthcare services. Senior transportation services such as shuttle service should be brought in, subsidized public transport. Initially, there was reduced transportation in Karnataka state government for 60 years and above. It was almost 20% or less. Okay, I would say all 60 years and above the transportation should be made free. Ride sharing programs for elderly and community transport networks. Okay, and in community transport networks, a separate what you say, in metros there is a separate compartment for females, but there is nothing for elderly that should be created. In general, healthy lifestyle, regular screening programs for elderly, mental health support, vaccination, and social support systems will be uh, good enough for handling the old age problems. Promotion, physical well-being. There is a program called National Program for Healthcare of Elderly, which provides regular health checkups and treatment of common geriatric ailments. Balanced diet, integrated program for senior citizens, which provides food and shelter. Exercise programs can be started through community centers and NGOs. Mental well-being, there is a program called Atal Vayu Abhyudaya Yojana, which includes mental health support and a comprehensive care. Okay, which includes counseling and mental health services. Social well-being, creation and participation in community activities. Rashtriya Vayushri Yojana provides assistive devices to help senior citizens to stay active and engaged. Like what? Like a crunches, walking, what do we say, as walking assistant devices, all these things. Wheelchairs. Apart from this, family support is more important. Financial well-being, there's something called Pradhan Mantri Vaya Vandana Yojana, which provides financial security through pension plans. There's something called NPS, National Pension Scheme, protection from abuse, education and resources to protect against scams and financial violation. Safety and environmental adaptations, that is home safety devices like hearing aids, glasses, mobility devices are provided through this program. Okay, and emergency preparedness. Holistic approach, integrated care, that is includes physical, mental, and social needs. Person-centered care, needs and values of the individuals, tailoring as per the individual's requirement. Community development by creating the friendly communities. This is the first question we have for today. That is only one long answer. Coming to the short answers, we have the first question. Is it necessary to universally breastfeed the babies and why? This will be asked in your Viva OC also. This will be asked in your practical exams also. This will be asked in your theory exams also. It will be asked in your pediatrics also. And it will be asked in OBG exams also. So this question covers majority of the places. Benefits for babies. It provides optimal nutrition. Breast milk provides the ideal balance of nutrients that infants need for healthy growth and development. Okay. Hence, breastfeeding is compulsory. Immune protection. Why do we give measles vaccine at 9 months, not before that? This is one of the reasons. The maternal antibodies protects the child which are secreted through breast milk for almost 8 to 9 months if the baby is fed properly. Hence, immune protection is provided by breastfeeding. What all infections? Almost all the infections, ear infection, respiratory infections, diarrhea, all. Okay. Reduced risk of chronic conditions. They have lower risk of developing asthma, obesity, type 1 diabetes, and sudden infant death syndrome. Digestive health. Easily digestible, reduces the risk of constipation, diarrhea, and stomach upset, whatever you want to say. It is burning, gastritis, whatever it is, GERD, which can one name it whatever. It is taken care of by breast milk in the children. What are the benefits for mothers? Breastfeeding reduces the risk of breast and ovarian cancers, type 2 diabetes, and high blood pressure in mothers. Okay. And it reduces the weight also of the mothers, which has a long way in reducing osteoporosis, osteoarthritis, uh, obesity, type 2 diabetes mellitus, hypertension, dyslipidemia. All these things are taken care of if the breastfeeding is done and the weight is reduced because of that. Postpartum recovery becomes easier, contract and return to pregnancy more quickly, and more importantly, it increases the bond with the child by releasing oxytocin, which is a love hormone. Okay. Practical and economic benefits: convenience, easily available at right temperature, at right concentration, at the right time. Okay. Cost effective, no need for formula feeds, bottle feeds, or feeding supplies, which can save significantly. These are the importance of breastfeeding. This question will be asked everywhere and anywhere which is related to mother and child. So please do remember that this is more important. And please do remember these three slides can give you almost save your life in your exams for next 2 years. Anthropo measurements of children to assess the nutrition. Okay. Why they are required? To assess the nutrition status of the children and to measure the malnutrition growth abnormalities or overall health status. These are these. One is weight for age. It measuring the child's height relative to their age. What does it identify? Underweight or overweight. Height for age, it identifies stunting and indicates malnutrition. If it is less, if the height is less for age, it indicates stunting and it indicates chronic malnutrition. Again, weight for height indicates acute malnutrition. Height for age indicates chronic. Weight for height indicates acute. Okay. Body mass index is not usually done for children. It assesses the overall body, helps in identification of underweight, overweight, and obesity. Mid upper arm circumference, conventionally done over left upper arm. Okay. Usually between the marked midway of acromion process and olecranon process. Less than 12.5 centimeters, severe malnutrition. Between 12.5 to 13, it is moderate malnutrition. Above 13.5, considered to be normal. Head circumference, again, measures the circumference of the child, important for assessing the brain growth and development in infants. We'll see how it happens in the next slides. I'll end the first poll now, and I'll be starting the second poll. Okay. This is the way how the mid-arm circumference is done. This is the olecranon process. Sorry, acromion process. This is the olecranon process midway. Okay. Coming to the head circumference, this is the expected increase in the head circumference. If any deviation is there, that means you should look for the changes of growth of the child. Okay. Head circumference growth of it is 2 centimeter per month, 3 months to 1 year, it is 2 centimeter per 3 months. You don't have to remember, but you should know where to refer. Okay. And the formula used is Dine's formula. What does it give? It gives microcephaly or microcephaly based on the standard deviation. Microcephaly looks like this, and microcephaly looks like this. Chest circumference, it usually measured at the level of nipples, preferably in mid-inspiration and xiphisternum in children. Okay. Less than 5 years in lying down position, more than 5 years in standing position. What is the relationship? At birth, head circumference is more than chest circumference by 3 centimeters, up to 3 centimeters. Usually, at around 9 months to 1 year, both of them should be equal. If it is not equal, there is something wrong. But thereafter, chest grows more rapidly compared to brain. If it is happening the other way, it is called as microcephaly. Coming to the next question, that is, describe the growth chart used in India and write it uses. Okay. What are growth charts? They are visible display of child's physical growth and development. It is called as Road to Health. Who designed it? David Morley, later modified by World Health Organization. There are three types of available: NCHS growth charts, CDC growth chart, and WHO growth charts. We use WHO growth charts, and this is how it looks like. It is separate for girls and boys. In India, it is modified for 0 to 3 years, but WHO growth chart is for 0 to 5 and 5 to 18. Okay, but it is modified in India for 0 to 3 years. This is available with the mother card, which is given to pregnant females. What does it include? 8 growth curves separate for boys and girls. WHO, it contains birth to 5, but in India it is 0 to 3, and again 5 to 18 years. Okay, it monitors the child development stage. What are the measures in that? Weight for age, which again gives the underweight or the overweight of the child. It helps detecting the stunting of the delayed growth. Weight for height helps in assessing wasting or acute malnutrition. Okay, it includes percentiles. This is the percentiles: 1, 2, 3. Red means danger zone. This is concern zone. If it is green, it is going in a right direction. Uses again for growth monitoring and diagnostic tool to identify the high-risk children. Planning and policy making by grading malnutrition, how many are malnourished. Education tool to make the mother understand that how well the baby is growing and what are our interventions required if there is any deviation of the growth. Evaluation of effectiveness of corrective measures. Once you have given the education, she can monitor by plotting herself, and after plotting it can be evaluated at what rate the correction is happening, and it is a tool for teaching the mother. Okay, next we have school health services. School health program. This can be a major question, 10 marker also, 5 marker also, but since it is a 3 marker, I have put the points as much required for the 3 marker. Okay, that is objectives. There are 5 objectives. Promotion of positive health, prevention of diseases, early diagnosis, treatment and follow-up of defects, awakening health consciousness in children, and provision of healthful environment in the school. Okay, there are around 12 aspects which include to support these 5 objectives. What are those? Health appraisal of school children and school personnel. Health should be monitored for all the school children and the personnel also. Why? Because communicable disease gets spread too faster. Okay. Remedial measures and follow-up for all the school children. Prevention of communicable disease can happen at schools. Healthful school environment. Nutritional services. There is something called midday meal scheme. First aid and emergency should be provided at any cost at school. Mental health, dental health, high health. All these 3 should be done at least once a year minimum. Okay. Health education for all the children. It includes hygiene aspects also. Education of physically challenged children. It is not handicapped anymore. It is physically challenged. And proper maintenance and use of school health records. School is supposed to maintain the school health record for all the children, and it should be transferred with the transfer certificate for the next school. Okay, this is the aspects of school health service. Since it is asked as a short answer, I've given the answer in this short way only. It can be asked as a short note as well as short essay as well as long answer. Okay, by this slide we'll be ending our class for today. I'll be ending the poll and I'll be sharing the results also. And the results are also being shared. Okay. Thanks for watching Auricle. We have social media handles in YouTube, Instagram, Facebook, and Telegram, and there is Google Play app for Android users and app on App Store for iOS users. Please do subscribe Auricle for further classes. See you in the next class. Thanks for watching.